Hey everybody, Dr. Jonathan Fabian here with Health Source of Riverton, and I am back to speak with you about our condition of the week this week, which is actually scoliosis. So, when you look at a spine straight on, it should look like a straight line. When you start to have things that cause side-to-side movement like this or rotation, that is called scoliosis. So scoliosis normally is what's called idiopathic, meaning we have no idea why it developed. It usually begins to develop in adolescence while we're growing, and in most cases it stabilizes once we finish growing. There's also some other causes. One of them is congenital scoliosis. In those cases, you've got something in your spine that didn't form correctly that caused things to be off kilter, and your body developed that scoliosis as a compensation for that. In any of those cases though, scoliosis can cause quite a few problems. For one thing, when you look at that curve, if you can imagine a rainbow, at the high point of that rainbow you're always going to have some instability, so people tend to have pain in there, and that can be problematic. It also changes the way that we bear weight in our body in a lot of cases, and so I often will see patients that have predominantly one-sided pain in the very bottom of their spine or up in the ribs. And so looking at those things, what can we as a chiropractor do? Well, one important thing is maintaining appropriate mobility in the spine so that we can actually decrease degeneration and increase function so that you're able to twist as far as you're supposed to and move the way you're supposed to. The other thing that's important though is we actually are able to do a few exercises that can sometimes decrease the angle of that scoliosis and make it smaller. The important thing with that is, obviously if you're still growing, the more we can decrease your current scoliosis, the less scoliosis you will end up with. And even in adulthood, by decreasing that, we decrease the risk of it progressing. The other time that scoliosis progresses is when we get older. If we lose bone density or have a lot of degeneration, then we can see that begin to progress again. So the smaller it is, the better off you are. So some things to look for to see if maybe you have scoliosis: if you have a big difference in the height of your shoulders or the height of your hips, that can point toward it. Also, sometimes you'll see that somebody's ribs seem to stick backwards more on one side than the other. Those are good signs that they may have scoliosis. We'd be happy to evaluate them and help them out. So if you or someone you love has scoliosis, or you think they might have scoliosis, please get them in. We'd be happy to evaluate them and see what we can do to help them live a more pain-free and less risk of having this thing progress as they get older. Thanks you guys, have a great week.